A 60-year-old man walks into the hospital complaining of fatigue, weight loss, and persistent stomach pain. On the surface, these symptoms seem ordinary, but beneath the surface, his body was fighting a battle that had been raging for decades.
Patient Theodore Craig's lifestyle and work history were filled with silent dangers: obesity, alcohol consumption, smoking, chemical exposure, and years of disrupted sleep. These risks didn't just add up, they multiplied, setting the stage for one of the deadliest cancers.
He was overweight, inactive, and relied on processed foods and alcohol for comfort. A retired construction worker and truck driver, he had spent years exposed to vinyl chloride, arsenic, cadmium, and organic solvents, chemicals that damage DNA and increase the risk of liver cancer.
Vinyl chloride, found in plastics, is a known carcinogen that directly damages liver cells, leading to mutations.
Years of sitting for long hours, night shifts, disrupting his circadian rhythm, and heavy drinking had placed his liver under immense stress. But he had no idea until it was too late.
Mr. Craig, have you noticed any changes in your skin, digestion, or energy levels?
I feel tired all the time. My appetite's gone, and I've lost nearly 20 pounds in the past few months. My skin looks yellow, and my abdomen is really sore and swollen. Jaundice, abdominal bloating, sudden weight loss. These all pointed to liver dysfunction. A sign that his liver was failing to process toxins properly.
Those alpha-fetoprotein, AFP, levels were elevated. This is a tumor marker that signals liver cancer.
Then, the imaging revealed the truth.
A 7-centimeter tumor in his liver. A biopsy confirmed the worst: hepatocellular carcinoma, HCC.
How did patient Theodore Craig's liver cells turn into cancer?
Every cell in the human body follows a strict set of instructions when it divides. This is called the cell cycle. A process controlled by genes and proteins that regulate growth.
In healthy cells, DNA is copied during the S phase.
The S phase is the stage of the cell cycle when DNA is copied or synthesized. It's critical that accurate DNA duplication it's existent because it's successful for all cell division. The cell needs to duplicate its DNA so it can be divided equally through the resulting daughter cells. The S phase is like a checkpoint kind of that responds to DNA damage. Any problems with DNA replication trigger a checkpoint that puts the phase on hold, so it stops until the problem is resolved.
And any errors are repaired before the cell divides.
But when exposed to carcinogens like vinyl chloride, alcohol, and obesity-related inflammation, DNA mutations occur. Over time, these damaged cells stop following normal growth rules.
Cancer cells ignore the body's control. They divide over and over and over again out of control, which forms a tumor.
In patient Theodore Craig, decades of poor diet, chemical exposure, and alcohol consumption had fueled this mutation process, leading to liver cancer. Because the tumor was too large, surgery wasn't an option. Instead, we turned to targeted therapy.
Drugs like sorafenib slow cancer growth by blocking blood supply to the tumor, while immunotherapy trains the immune system to fight cancer cells.
For advanced liver cancer, treatments focus on slowing the disease rather than curing it. Unfortunately, patient Theodore Craig's cancer was too aggressive. Despite treatment, his liver function continued to decline. Within months, his body could no longer support him. He passed away due to hepatic failure.
His story is a warning sign for millions at risk.
Liver cancer is preventable. The question is, will you take action before it's too late?